For the week ending December 6th, the average number of positive tests each day in Boston for residents was 438 people. That number spiked, obviously, after Thanksgiving, and we've stayed at that elevated level for most of December so far, so we're pretty much into our third week now of high numbers. Our community positivity rate for the week ending December 6th was 7.2%, and that's up from 5.2% the week before. Dorchester, East Boston, Hyde Park remain the neighborhoods with the highest positivity, between 10 and 12%. Roxbury, Rosendale, and South Boston are all over 8%. And we also saw increased positivity rate in every single neighborhood in our city. So last week was one of those weeks that every neighborhood went up to some percentage degree. So wherever you live or work in Boston, the COVID virus certainly has been spreading. In addition to the elevated case data, activity in Boston hospitals continues to increase. We are in contact with our hospitals on a daily basis, and on each of our key metrics we track, the data is moving closer to our threshold for concern. Those include daily emergency room visits for COVID-19, the ability of adult medicine and surgical beds, the availability of adult medical and surgical beds, the total occupancy in our intensive care units, and we're also seeing increase in activity in our Boston EMS calls, our 911 calls. I speak to our hospital leaders frequently. They certainly have surge plans ready and will be able to expand the capacity and treat everyone who needs it. They are not in danger at the moment of being overwhelmed, our hospitals, but they are seeing confirmed the continued spread of the virus. It shows more people are getting sick, and that's what one of their concerns. I was talking over the weekend to a hospital president, and what he was concerned about was we're seeing more and more people get sick and more people having to go to the hospital. If these trends don't stop, it will be a very difficult winter for our hospitals and for a lot of people. So our public health experts have been analyzing this data closely and developing a plan. And rather than wait until the situation gets worse, we're going to be proactive here in the city of Boston and other towns here in Massachusetts. We're going to take action now to reduce in-person activity in our city. We're working to slow the spread of the virus in our city and prevent our hospitals from getting overwhelmed. So today, this afternoon, the Boston Public Health Commission issued a supplemental order adjusting COVID-19 restrictions in the city of Boston. Starting this Wednesday, December 16th, Boston will be moving back into a modified Phase 2, Step 2 of the reopening for at least 3 weeks. Our goal with this 3-week pause is to slow the spread now so we can avoid more severe shutdowns later on. Our focus as planning this action has been to prioritize essential activities like getting more high-need students and children back into our schools, as we are doing today, and I'm going to talk about in a couple minutes. In addition, we've been in close contact with the communities all across Greater Boston. We're going to take a regional approach for maximizing effectiveness. Several cities and towns are taking steps this week with modifications fit to their particular needs. They include the City of Newton, Somerville, Brockton, Town of Winthrop, Town of Arlington, City of Lynn, and other cities and towns that will be announcing over the course of the next couple of days actions that each of them are taking. Before I mention some of the activities affected in Boston, I want to be clear. This is not about targeting specific sectors that cause the virus. This is an effort to reduce overall activity outside the home using mechanisms afforded by the state's reopening plan. In fact, we want to minimize the negative impacts on working people and small businesses. After 3 weeks, we will then reevaluate the situation to see where we are with the virus here in the city of Boston. If these metrics have moved in the right direction, and we hope they will, we will lift these restrictions. Some of the changes include museum, movie theaters, aquariums, and indoor event spaces will temporarily be closed to in-person use. Fitness centers, health clubs, gyms closed for general use. One-on-one personal training can continue with space restrictions. Outdoor gym activity can operate with fewer than 25 people following the Phase 2 guidelines. Indoor recreational and athletic facilities will be closed for general use, consistent with Phase 2. Structured youth programs at community centers may continue. Indoor facilities for lower contact activities will also temporarily be closed, including bowling alleys, batting cages, driving ranges, and rock climbing. I want to just say to all the businesses, I want to thank you for your support, and the cultural institutions for your cooperation and support during these very difficult times. The vast majority of people have worked very hard in full compliance at every single stage, and you will have our full support in the reopening and the recovery efforts. Activities that continue as part of Phase 2 include, this continues, retail stores, personal services like hair salons, barbershops can remain open, outdoor theater and performance venues at a 25-person limit, office space will remain at limited 25% capacity, but I want to urge all employers to make sure that anyone who can work from home is working from home. In addition, indoor dining at restaurants and bars may continue with strict adherence to guidelines. That includes 6-foot spacing, 6 people per table, 90 minutes time limits, and 9:30 closing times. One change during this pause is bar seating will not be allowed except with special approval granted by the Boston Licensing Board. That's to ensure materials are in place to protect both staff and customers. I know that many people have concerns about indoor dining. These are concerns about the possibility of viral transmission. There are concerns about the ability of restaurants to survive closure during these restrictions. I hear both of the concerns, and we're responding to both of the concerns. Our approach is to follow the Phase 2 guidance with additional restriction. We are restricting bar seating to special approvals, as I mentioned, and we are increasing enforcement of all guidelines for all licensed businesses. We will have emergency license board meetings every Monday to address any violations from the previous week. But I also want to appeal to restaurant patrons and small business customers to be part of the solution. We hear from owners that it can be difficult to please customers who keep their masks off or ignore distancing guidelines. So I ask you, if you dine in a restaurant or you visit a store and you want to help small businesses stay open, do your part and follow the guidelines. And whatever possible, use takeout and delivery services to give our businesses business, but also allowing people to have safe experiences.